Dr. Brian Christine, and yesterday I put a post out on Facebook and I tweeted out about the efficacy of male slings to treat post-prostatectomy urinary incontinence. There's a number of men who after a radical prostatectomy will have persistent urinary incontinence, and this can really be a devastating complication. Men, they won't go play with their grandchildren, they won't go hunt, they won't go out with their friends, they won't go to church because they leak urine. It's something that really distresses them. And there are treatments for stress urinary incontinence that are incredibly effective. One of those treatments for a man who has a more severe degree of leakage is something called an artificial urinary sphincter, and I'm going to address that in a subsequent video. But today I wanted to talk about what we do for men who have kind of that mild to medium degree of incontinence, and the answer is a male sling. For a man who has not had radiation treatment after his prostatectomy, who has a mild to medium degree of leakage, and who has good findings on some office testing, and that includes doing something called a cystoscopy, where we look in the bladder. It's nothing painful, but a man who has good findings and is a good candidate for a sling can have a great outcome. Recently, we've gone through and we've updated our data. This is my personal data from almost 500 men who have had a male sling to treat stress incontinence, and our findings have been very consistent throughout the years. And I can tell you that if a man is a good candidate for a sling with his post-prostatectomy incontinence, in my hands, he's going to have somewhere between an 81 and 82% chance of being pad-free. So when a man comes to see me, I can tell him with confidence, if I think he's a good candidate, he's got better than 8 chances out of 10 of being dry. Now the problem is that some urologists will treat every incontinent patient with a male sling, and that's not appropriate, that's not reasonable. In surgery, you've got to have good judgment. You've got to find the right surgery for the right patient. And for the right patient, a sling can work well. I invite you to check out my website, drbrianchristine.com. You'll get more information on slings. You can see videos of the sling surgery and the artificial sphincter surgery. And you can find the contact information for my patient liaison, Lisa Bowman. She can set up over-the-phone consultations if, like many of my patients, you come from out of state. And we're actually moving into now where I'll be doing real-time, face-to-face video consultation over the computer. Check out my website, get yourself treated, and get it done.